Hi everyone, welcome back to another video. This is a little bit different. This is a Q&A, your yearly Q&A. The last time I did this was about this time last year. There are some really juicy questions here, so I'll get right into it. There are over 20 to get through, so I won't yap for too long. A big welcome to those who are new to the channel. If for those of you who haven't come across me before, I'm Emma Cubis. I'm an oral health therapist based in Melbourne, Australia. You'll find me online as at emma.cubis on Instagram and TikTok. I put a Q&A box out on my Instagram a couple of days ago and there were some really different questions that came through, so let's jump into it. If you could go back in time from a day one fresh out of uni, knowing exactly what you know now, what are some ways you would have directed yourself differently towards your career within the first 5 years of being an OHT? That's a really hard hitting question. I've got 4 major points that I'll touch on today, and the first is to master your communication. When I first graduated as an OHT, I genuinely thought success meant mastering a period chart, charting perfectly, getting faster with my instrumentation, because patients don't remember your scalar technique. Like, that's what we're taught to be able to demonstrate through uni, making sure that you're using this instrument properly, but they're going to remember how you made them feel. That's just bottom line. Whether they feel understood, whether you make them feel valued and welcome, being able to explain treatment simply. People don't know what caries is. Don't use the word caries, use the word tooth decay. So it's simple things like that that go a very long way. And this is why there are so many motivational interviewing courses and communication workshops and day courses out there, because this is something that a lot of people struggle with coming out from uni, because we are taught to be book smart, not necessarily street smart. So make sure you learn how to communicate effectively and efficiently from the get-go. Number 2, I would say be strategic with your workplaces. This is something that I wish that I did personally. When I graduated, I was fairly relaxed. I've spoken about this before on my page. I took a couple of months off because I just needed it after uni and study, and I was very, very blessed to be living at home and not being able to worry about certain expenses that come with living out of home. So I took a good 2 months off before I even started looking for work. Obviously my other peers had already been looking for work / locked in work even before we graduated. The type of work that was available when I started looking was a few part-time positions. I've always loved perio, and that is what I gravitated towards when I graduated. So I ended up in this practice where I was practicing mainly perio and hygiene, as I wanted to. So that was a few days a week, and then I worked in a general practice that did a lot of expansion orthodontics, and that for me was amazing because I learned a whole scope within dentistry that I had learned nothing about through university. So that was amazing. The only thing that I maybe lacked in that first couple of years was a huge amount of therapy. And I spoke about this on a podcast episode with Hannah, a OHT who's now working in a remote community, who's getting a huge amount of therapy experience, is that if you don't use it, you'll lose it. And in the first 3 years of practicing, therapy with children, honestly, makes me so stressed out. Adults, teens, fine, but children, I just don't like seeing children in the chair stressed, anxious, crying. It was just not for me. And so I actively almost avoided doing therapy, because I was in a practice where the dentist did a lot of sort of expansion dentistry. There were 2 other dentists in-house that did a mainly general dentistry. And reminder, we're talking over 10 years ago. So OHTs did not have full scope, and it was a pretty different landscape back then. If you were an OHT and you wanted to do quite a lot of therapy work, from my experience, this was quite tricky in private practice, which is why a lot of people went private. So long story short, I wouldn't settle in one role for too long if you find that it's limiting you. If you are finding early on, say you've given a job 3 months, you're not getting any therapy, I would make a quick decision stat to make sure that you weren't in that for too long, because that's probably one thing that I did. Luckily, I really do enjoy perio and I genuinely don't miss practicing therapy. My 2 cents that if you are finding you are feeling limited, it's time to make a move. Tip number 3, make sure you prioritize work-life harmony. I did a podcast episode with Dr. Cajun Chia where he mentions that work-life balance is a fallacy, because you'll never be able to achieve that, because life changes, life throws different things at you, there are different life stages that you go through, and it really makes sense. So listen to that episode if you haven't already. But I remember in my early years, I just felt really, really bad calling in sick. And I would be at work stuffing cotton rolls up my nose to work. And now I look back and think, why the hell did I do that? If you are sick, you are sick. Go home, stay home. But I feel over the last decade, this is something that Gen Zs do very, very well. They are unapologetically fierce about looking after themselves, their mental health, and preventing burnout. And they are a lot better than what I feel us millennials were back in the day. And make sure you're in a clinic that supports your well-being. I remember working in a practice where if you were to take a day off, I would have the practice manager ask me to work an extra day to basically make up for the day that I called in sick. Don't be me, don't do that. Also, ergonomics. I bang on about this all the time, but if you do not look after your body, whether it's lifting, reformer Pilates, mat Pilates, running, whatever it is, if you aren't looking after your body will let you know very soon. It might not tell you very early on, but it will eventually. Ergonomic loops were not around when I graduated, but they are now. So save up for them. Do not hunch over. Do not sit there with your neck all crooked like that, because everything is connected. If your neck's out, your shoulder's going to be out, your back's going to be out, your hips are going to be out. It's just not worth it. Yes, they are a pretty big investment up front. You're talking at least 5,000 AUD for ergonomic loops. Mine are 4 times magnification and I love them. I've been using mine for over 2 years. They're biomedical, not sponsored. I love them. But that is something that I tell all new grads: get yourself ergonomic loops as early as you can. And lastly, if I could turn back time, I probably would have added more depth into my career earlier on. And what I mean by that is thinking beyond the dental clinic. So for some people, that's maybe research or advocacy. These days, it can be content creation. These pathways probably don't sound urgent earlier on in your career. And for a lot of people, it won't be, but you'll reach a point realistically, and you will find that as time goes on, a lot of people don't work full-time in dentistry because it is hard on the body for reasons like I've mentioned. And so you'll see a lot of us actually split our time between maybe academia and working for a company and working clinical, or completely leaving clinical altogether. So that's probably not something that you're going to think about, and that's why I mention it at this point, because trust me, you will. Okay, next question. My favorite figs color. I would probably say I love Wayfarer. That's one that I reach for a lot. I reach for espresso a lot, and I also get complimented on lavender dew. I was going to say Lavender Haze, the Taylor Swift song. If you had to feature in a reality TV show, what would it be? This one's actually funny because I've actually been approached in the past for Survivor, brains versus brawns. But when I thought about it realistically, I was like, could you picture me swimming out into the ocean for food? like, no. If I had to pick one, I reckon I would love to do the Amazing Race. I feel like I would love that because number one, travel. I love traveling. And number two, just trying new things. Like I've done bungee jumping before, skydiving. Put me down for the Amazing Race. Some Swifties in the Q&As. Are you excited for the new Taylor Swift album? Absolutely yes. My favorite Taylor Swift song, and that's a very hard question. I would say one of the songs that I will never get sick of is Wildest Dreams. I love Wildest Dreams. Favorite Taylor Swift album, Reputation or 1989. Gemma says, convince me to do an iTOP course. Gemma, challenge accepted. So the one thing I will say that I absolutely love about the iTOP courses with Curaden Academy is that a lot of CPDs basically focus on what you can do, whereas iTOP is about what you can help your patients do on their own. So instead of just telling people you've got to brush better, you've got to floss better, it's about how you can coach people better one-on-one to help them achieve this using hands-on techniques that your patients will actually remember. I don't know about you guys or how the courses are now. I think they're a lot better now, but I really don't remember really precise instructions on how to use different types of oral hygiene tools available. Yes, we're given electric toothbrushes at the end. Yes, we're told to tell our patients how to floss, but maybe this is just my memory not serving me correctly, but within the iTOP, you were actually shown very precisely how to choose, use, and demonstrate different types of tools available to help your patients with their oral hygiene instruction. You're basically taught how to teach oral hygiene like you're a personal trainer for your patient. And I think this is a really important point to touch base on because anyone can scale and clean, polish teeth, airflow teeth, but you want to be the clinician that really brings home for your patient exactly why it's so important to focus on their oral hygiene. After doing the iTOP course, I would add that to your resume because what you would have completed is a course that is evidence-based, patient-focused, and you'll be skilled in preventative dentistry and oral hygiene instruction at the highest possible level. And this will make you stand out to employers. So if you skipped right to the end for me to get to a point, iTOP basically bridges the gap between knowing and doing. It transforms you from someone who just tells someone to do something into becoming their coach for desirable behavior change. So Gemma, I hope that has convinced you. What is my dream car? A Land Rover Defender. If I had fun money, if I win the lottery one day, I would buy a Porsche 911 Carrera just to, zip around town in. A girl can dream. My favorite Real Housewives series, I've only watched one from start to the current season, and that's Salt Lake City. Career advice to step into more corporate roles / health promotion within dentistry. I'm getting well aware that this Q&A is getting quite long, but I have done podcast episodes on this with some really incredible guests. Episode 71 coming soon. I've got the awesome Danielle Hammond. She's currently working in corporate in an occupational health and safety role, and she chats about her experiences working in corporate, how she got there. And then if you were wanting to know a little bit more about health promotion, I would recommend listening to episode 64 of the podcast. And also, I haven't even actually introduced the podcast. So I have a podcast that's called Talk Dental to Me. You'll find it on all major streaming platforms like Spotify and Apple Podcasts. The podcast, we talk about all the things you wish you knew more about, topics you wish you knew more about, career pathways, and episode 64 with Shelley Pham. She's a health promotion officer and I believe now lead with Dental Health Services Victoria. So she chats about all her role, the extra study that she did, the clinics that she worked in to get to her role. So I highly recommend looking into those 2 episodes. Any tips on what to say when asked when you're leaving your current role? So probably the number one thing I would say is that the dental industry is small. I have spoken about this before on previous YouTube videos, on previous podcast episodes. Everyone knows somebody. You might not think that as a student, but when you come out, you will learn very quickly that someone's dental assistant has worked with a dentist you've worked before, who's worked with an assistant that worked with them through uni. So everyone knows someone. I have very rarely come across an individual within the dental space that does not have any mutual connections. So long story short, you want to leave on a good note. So if you are leaving, I would stay positive. Unless you feel really compelled to say something, I would definitely keep a positive tone. You never want to badmouth your boss or a principal dentist or a practice manager that you once used to work with, because it's probably going to make the interviewer or panel think, like, what is this person going to say, for example, if she leaves our organization one day. I would say focus on growth, really emphasize where you want to grow rather than what you might be escaping, even though that may be the truth. But what I would also do is I would then almost flip the conversation and say why their role is exciting for you, which is why you may be leaving the previous role. And then you can just tie the conversation off on a more positive note. So for example, if you haven't been able to use your full scope in a previous role, you may be able to phrase that and say, I'm looking for a role that will support me in the way that I would like to practice and the way that I would like to grow my career. You can use that one. Favorite cafe in Melbourne? I would have to say it's an institution that I go back time and time again, Middle South East, on Chapel Street in South Yarra. Absolutely love. They have never made me a bad coffee. They have never made me a bad meal. Highly recommend. My favourite sport to watch, I love rugby union. I am a Kiwi gal, spent the first 10 years of my life there, so I do love rugby union, and I also love watching tennis. Have you ever worked in public previously? I'm a new grad going straight to private and feeling almost a bit left behind compared to my colleagues who are practicing in public. To answer your question, no, I have not worked in public. And leading into the next question, I'll answer them together. One of the questions was one career regret. And for me, I think that's not working in public. I wish I did. I wish I added a little bit more into my week, but at that time, I was thinking about it. I was in general dentistry. I was working 3 jobs. I was doing the maternity leave position, general dentistry, doing expansion orthodontics, and then a specialist orthodontic clinic as well. So I just had a lot going on. And this was sort of within the first 2 years of my career. And I really wish I sat down and almost wrote down what I envisioned for my career. I would say that if you do feel like you're going to be left behind, and by this I'm assuming you feel maybe you're not going to get enough therapy experience, then I would maybe start applying for public jobs, because there are quite a lot of them out there. So if you're feeling this way, make a change. I think I'm slowly starting to hate full-time clinical. Help us this out, please. What are my options? So I think I've sort of touched on this in a previous question, but I'm going to refer to my podcast again because I've had some great conversations with really, really awesome OHTs who have gone down the non-clinical route. So I've just listed a few here. Health promotion, I've had a traveling OHT in the podcast, someone who's working in occupational health and safety. I used to work with an OHT where she loved working her retail jobs. So she would work part-time dentistry and worked part-time retail, and she got really good discounts and really loved that mix. So the great thing about our industry is that you can really curate your week the way that you want it. So you can do anything, honestly. It doesn't even have to be within dental. Who else have I had on the podcast? Tom, he's an implant solution specialist with Straumann. I had a clinical lead on the podcast. There's obviously academia. You can do content creation, UGC, social media, which is sort of the field that I love and work in. I highly suggest looking for those Talk Dental to Me podcast episodes, listening to every single one, and hopefully maybe one of those will inspire you. My go-to breakfast, I love eggs on toast on the weekend with some chili oil mixed through and an iced almond matcha when I've got the time to make it at home. If it's during the week and I'm running low on time, it'll be either, I know this sounds really plain and boring, but boiled eggs. They're just really easy to make and just chuck in my backpack, and an almond latte if I'm on the way to work. Anything with egg, basically. I love eggs. How old am I? It's on my page somewhere. I have posted it. If you really want to know, you can, it's on my page somewhere. Noticing a massive reduction in our books up here. How are things going down there? And any recommendations on trying to fill books, doing the obvious recalls, advertising, etc. I work for 2 corporate clinics. I'm luckily able to say that my books are full and everyone else's books are pretty steady. There are some days obviously where books will fall apart last minute, or in winter people are sick, but I will say all in all it's quite steady. So it sucks to hear that your books are taking a hit at the moment. Some tips to fill books. Reactivation of inactive patients is a really good one. A lot of the dental softwares, you can actually generate reports that will show you who hasn't been in. We usually do that for patients who haven't been in maybe 12 to 24 months by either giving them a call or an email to touch base, and that's a good way to help reactivate patients. At reception at one of my clinics does really well is if they've got a family member in and they notice they've got either children or a partner that haven't been in a while, we'll actually say, hey, while you're here, would you like to book your children? And we haven't seen them for a checkup in a while. And 98% of the time that actually works very well. So highly recommend. One thing that I think my clinic will most likely start doing very soon, coming up to springtime, is a teeth whitening promotion. That's something a lot of people start to think about as they come out of winter. I tend to do a teeth whitening promotion every year, so that's another. More on the individual clinician level, particularly for hygienists and OHTs. One thing that I like to do is really ensure that if a patient should be on a 3 or 4 monthly, making sure you are communicating that with your patients and doing your best to have them actually book in within that time frame. So for me in particular, I've got quite a lot of patients that I see every 3 to 4 months, but I know what it's like being in a clinic where everyone's just used to coming in every 6 months and you're the one trying to educate them saying, no, you've got diabetes, / you do have a lot of build-up, you need to come in sooner. Having those conversations can be tricky, but that's one thing that I find really helps my books, is that ensuring your patients are coming in for their appropriate recall. All right, everyone, we're at the last question. If you made it this far, I appreciate you. What do you do step by step in an appointment? How long for recall, perio treatment, and maintenance? So number 1 for me is always continue building that rapport with patients. I'm very lucky in my clinics. I'm quite flexible. I can choose how long I would like for my appointments. One clinic I usually have 60 minutes and the other clinic I usually have 40, but I have a full-time dental assistant for those shorter appointments. My patients I've been seeing for quite a number of years now, so it's always a bit of a catch-up session to start, telling me what their previous travels were like. I absolutely love that part of the appointment. I love speaking to my patients because I feel like I get the best life and travel recommendations. And then we start with updating their medical history, any changes in risk factors, medication, stress, sleep, any concerns, of course. And then at this point, I usually let my assistant know that I need the dentist if they need to come through. At the start, I'll always take my records. So if they need an updated perio chart or bite wings, PAs, OPGs, I'll always take them at the start of the appointment. Usually the way our clinic works in terms of patient flow, the dentist will just come through when it suits them best. So I like to take all my records at the start of the appointment just to allow the flow of the day to be as smooth as possible. So then I'll do what I call like a screen. As an OHT without adult scope, I cannot treatment plan. I always basically leave that up to the dentist. So if I see anything out of the ordinary, like obvious decay, areas that I'm keeping an eye on for perio or gingivitis, I'll always recheck those areas and take any updated clinical photos. Photos are very powerful. Always use your intraoral camera. If you don't have one, get one. And then before I start the clean, I like to do my OHI and coaching. So it's always good to know exactly where your patients are, and I do ask every single patient every single time because things do change. As we know, health isn't guaranteed, habits aren't always consistent. I always like to touch base with my patients. For example, I get patients who say, yeah, I've been using my electric, and then they move house and they've been using their manual toothbrush and their plaque disclosing is showing a very different story compared to 6 months ago. So I always like to touch base with patients. What are you using to help look after your smile? Keeping questions open-ended rather than saying, do you brush? Patients are going to always say yes. And do you floss? They're always going to say yes. So keep your questions open-ended so you can get a little bit more information, and that can also help guide your conversation into and incorporating iTOP. If you end up going to an iTOP course, Gemma, I'm looking at you. At this point, it's ensuring that your patients are properly sized up for any implants, interdental brushes between there. They're using the right combinations of tools. If they're not liking what they're using now, helping them with alternatives, and so on and so forth. If the dentist hasn't come through by this point, I'll just go ahead and get started with the hygiene appointment. So at both of my clinics, I'm very, very lucky. I do use the airflow prophylaxis master unit in both clinics, which is amazing. So we'll always start off with plaque disclosing. That's really part of the OHI process. Actually showing the patient in the mirror is crucial because some patients you will get come through and they brush pretty well and plaque looks virtually invisible. So I always show my patients in the mirror their plaque results and take photos if I can, because they're so powerful and really instrumental at future appointments, because some patients are really engaged and they like seeing before and after. And with the guided biofilm therapy protocol, GBT, you always start with the airflow. So that's that plaque removal. Any of that hardened calculus tartar will then remove with the P-Zone. I feel like I'm really steamrolling through these, but I'm trying to be cognizant that this video isn't going to go for 60 minutes. Then we'll do our preventative add-ons at the end. So if I think a patient's more high risk, we'll probably add Durafat varnish, maybe recommend some tooth mousse, maybe the dentist will recommend some Nutrifleur. Very tailor-made, very risk-based for the patient. And if we're seeing lots of caries, at this point, if the dentist has been through, they've already had the dietary chat, they've already had the acid reflux, the snoring, the bruxing chat. So I don't really need to double down on this unless the patient has any additional questions when the dentist leaves the room. And then before the patient is dismissed, I always like to do a little summary of the key points. I always like to do I always give my patient 2 tips to take away from the appointment. So whether it's to use tooth mousse because we saw those incipient lesions, for example, or it's I need to see you in 4 months because there's much more inflammation and bleeding today, and we really need to keep a close eye on that because that chronic inflammation in the mouth is not great for your overall health. So we need to get that under control. So I'll always try and leave my patients with 2 key takeaways right at the end of the appointment. And I think that's it really. I will always try and book my recall appointments in the room in the surgery. Sometimes the reception out front's really busy or they're on the phone. It's a great way of being proactive with your own books, making sure that your books are productive and that you're filling them for the months ahead. And also I get to control exactly how long my appointments will be. So I actually personally don't mind booking the appointments in the room. And that's it for all the questions, everybody. I hope that was helpful. If anyone needs any more clarification, feel free to DM me on Instagram. That's emma.cubis, or send me an email. I'll pop my details down below. If you have any topics that you would like me to expand on or take a deep dive into, let me know and I will do my best to make it happen for you. But thank you so much for tuning into this video, and I will see you in the next one. Thanks guys, bye.